Surgeon General has declared gun violence a public health crisis in America. Gun violence is the leading cause of death among children and adolescents in this country. More than half of U.S. adults say they or a family member have experienced a gun-related incident. The first of its kind advisory also lays out strategies that address the crisis. And Dr. Vivek Murthy spoke with CBS Mornings earlier about the impact of gun violence.
There are solutions here. We don't have to live like this. And I lay out a series of strategies in this advisory that can help us reduce the profound toll of gun violence and help recognize that this is an issue that's infiltrated the psyche of America. People are scared in many communities I visit around the country to do normal things like go to school or the grocery store or work, and they're worried about the risk to their life.
For more on this, CBS News' Natalie Brand is in Washington. Natalie, what does this declaration mean?
Lindsay, good to join you. Well, again, this is a first-of-its-kind declaration, and one of the key goals here is to frame this through a public health lens. As you noted, gun violence now the leading cause of deaths in children and teens. So the report, this landmark report, really digs into the impact on individual communities, the physical trauma, also the mental health toll that it's taking, and gun safety groups that I've been talking to, they hope that this really not only sounds the alarm, but serves as a call to action, not just at the federal level and to lawmakers, but really at the community level and individual things that people can do, including talk about safe storage, education, even encouraging doctors to talk about gun safety at regular health checks. Those gun safety advocates also draw a parallel to the Surgeon General's landmark report and declaration decades ago, back in 1964, around the dangers of smoking and cigarettes. They hope that this can lead to a similar sea change in how this issue is addressed, leading to new policy and public health initiatives, Lindsay.
And Natalie, just to reiterate here, this declaration from the Surgeon General doesn't necessarily have teeth. I mean, it's up to Congress, which doesn't have the appetite to do this, or state legislatures.
Yeah, it has a number of suggestions, but as you noted, there's no force that will cause lawmakers to act on this. I do want to note that after the shooting massacre in Uvalde, Texas, at Robb Elementary School, Congress did pass back then in 2022 bipartisan legislation to address some gun safety and violence issues. But since then, stricter measures have faced intense gridlock, including a ban on automatic weapons. That's something that the Surgeon General here calls for, the Biden administration. But again, short of congressional action, the real goal is to get people talking at a number of levels, again, from the very top to community leaders, to try to take a multifaceted approach here and also not only put this in the political lens, but really the public health lens as well.
Natalie Brand, thank you.